Okay, Mark, so glad that you decided to come in and talk to us today. Um, Healthcare has been a topic that's near and dear to me just because of the cost, and I'm sure for many Americans and people who live in our community, healthcare is a large expense or an expense that people have to I wouldn't say worry, but be concerned about in their budget. So you guys are building or finishing out a new facility.
Yes.
You guys are expanding. So won't you talk to us a little bit about the new facility and about your business?
Sure. Thank you, Brian. Well, first of all, I'm really glad to be here with you today. I appreciate you inviting me. So I'm the CEO of Pinnacle Family Health. And Pinnacle was formerly known as, or is currently known as, Go Care Community Health Center. We've been around since the late 80s. We started as an HIV agency, but over the years, we have progressed into a community health center that provides primary care, behavioral health, and support services that's really geared toward the entire medically underserved population in Northeast Louisiana.
So when you say medically underserved, that's not exactly the full range of where you guys are going. You are building out a family care clinic.
We are.
To where you're trying to attract all walks of life.
Exactly.
One of the things that kind of caught me off guard when looking that I really liked was you talked about the uninsured, the insured but doesn't have enough insurance, and the people that have insurance but they're looking for something different, or they're looking for one place to go to take care of everything. So when I saw that you're here to serve those that are insured but that don't have enough insurance, I mean, it just made me smile because for our family, all we can afford is major medical. For us to go out and get, because I'm self-employed, for me to go out and get a quality health care plan, I mean, we're probably looking at $3,000 a month to be able to cover my family without having the really, really high deductibles. And you're offering an alternative to that.
Right.
So tell us a little bit about the kind of the different levels and how the pay structure works a little bit.
Okay. So this has really become a passion, not just for me and our administration, but our entire board. The community health center model is such a fantastic mechanism for everybody to have accessible health care. And when I say health care, I'm talking about that in the broad sense. Whenever we move into our new facility, not only are we going to be providing primary medical care for pediatrics to geriatrics, we're going to be providing behavioral health care for that same range. We're going to have on-site diagnostic radiology. We're going basic radiology. I'm just talking chest abdominal X-rays. No MRIs or CTs or anything. We're going to be having an on-site pharmacy. Reliant Healthcare, which is located right here in Monroe, is going to be placing a pharmacy on-site for us so our patients can pick up their prescriptions as they walk out the door. And then our biggest feat that we're trying to accomplish with this expansion is that we're going to be putting in a dental clinic with 6 operatories and panoramic x-ray capability because we have such an unmet need for dental care, predominantly among the Medicaid population. But, we just have a shortage of dentists in general in this region. And so we're really excited to be able to offer essentially a one-stop shop for people to come for their health care, whether that be someone like me, a professional who has comprehensive medical care, or someone like you who has one of those basic policies where you need to get all of your care in one place, then down to our folks who have Medicare, Medicaid, people who don't have any insurance, where oftentimes the people in those situations are of lower income, and so they often avoid receiving the health care that they need because they think, oh my Lord, I can't afford it.
Sure.
I'm not going to go because I can't afford the bill. Well, that's what I love about this community health center model, where the proper name it's a federally qualified health center lookalike. And so that we're given that designation by the Health Resources and Services Administration of the United States Department of Health and Human Services. And what we have to do is we have this litany of requirements that we have to meet in order to achieve that designation. And one of those requirements that we have to meet is that we're required to offer a sliding fee discount program for anyone who is at or below 200% of the federal poverty guidelines.
And that's 200%. So looking at it for our area, there's a lot of people. There's a lot of white collar job people,
Absolutely,
not that would qualify for the
Yes.
sliding scale as well.
Absolutely.
And that's the one thing that's like when we talk about affordable health care, I know that it's expensive for these drug manufacturers to go out and bring out new drugs, and for the testing equipment is really expensive. But it's gotten to the point to where, man, some of it's getting out of control, and it's really refreshing to see people like yourself that's trying to push forward with quality health care to service the whole community,
Yes.
but also offer options that can help those who just have a little bit tougher time to be able to pay.
Exactly.
Something that's more affordable.
Right. And in fact, going back to that sliding fee discount program, if we have someone who comes in that let's just say they're totally uninsured and they make under 100% of the federal poverty guidelines, you know what they pay us? $10.
Wow.
They pay $10 for their comprehensive medical visit.
And they're not going to receive a bill from you.
And they're not going to receive a bill.
Wow.
They fill out the paperwork, and we have documentation showing that they qualify for that. And the reason we're able to do that, again, because of the health center program, because of that lookalike designation, we receive enhanced Medicare and Medicaid reimbursement rates. And so we receive a higher reimbursement rate than a traditional medical practice would
So it helps
receive.
offset that cost.
Helps offset the cost. And in addition to that, we are able to participate in what's called the 340B drug discount program. That's been our lifeline for years, and back when we were solely an HIV-specific practice, and that has carried over into our community health center practice. As a 340B eligible entity, we're able to purchase prescription drugs at a substantially discounted rate, and in turn, we're able to bill the insurance companies at the regular retail rate. And so that profit that we make on that, coupled with the income that we generate from the enhanced Medicare and Medicaid reimbursement rates, that's how we support our sliding fee scale patients. That's how we are able to offer that.
Spread
When
the
otherwise
cost,
we wouldn't
yeah.
be able to. We're able to spread that cost out.
That's just really nice to hear.
And essentially what that's called is so the money you generate from the 340B program and from the Medicare and Medicaid reimbursements, that's considered your program income. Sure. And we're expected to put that program income into the furtherment of the health center.
Sure. And, for those who may pick and say, well, that's just kind of government waste. Why are you doing that? I think what people have to realize is that that's helping our community.
Exactly.
That's lifting us up to a level that we've never had before.
Right.
Many years ago, the EA Conway was considered a charity hospital around here. Now, we've had a large corporation, and they've been through several. Yep. It's no longer a charity hospital. I think that they have some requirements that they have to meet within those guidelines, but we just don't have the medical that we used to have here for those who don't have anything.
Right.
And this is an opportunity. But on top of that, we've got a one-stop shop for community, no matter what your background is, if I understand you correctly, to be able to come in and have quality, affordable health care.
Exactly.
Which I think that's a term you don't hear as a fact in an area. It's typically more of a dream, but for us to be able to have that here, man, I'm just really impressed, and I think it's going to be a great thing for our area. Something else when I was going through your website that I thought was unique, and I know it's got to have a major impact, but over 51% of your board has to be patients.
Yeah.
So the people who are involved in making the decisions are the people who actually use the service.
Right. That's one of the fantastic aspects of the health center model. HRSA believes in patient-driven outcomes with the health center. And as part of that, they require that at least 51% of your board members be comprised of people who consume your services at the health center. And I'm glad to report that now we're at 64%. So 64%
Wow.
of our board members are patients of our health center. And so that way, when we have our monthly board meetings, we're getting that individual, specific patient input of what could work better, what's working well, what's not working well, what needs to change. And we're able to have that firsthand knowledge, think, yeah, this is how we can do better. These are the things we can do to really reach the people that we need to reach, so that we're reaching them in a way that it's affirming to them. So it's something that they find valuable.
So it also, I guess, would have an impact on wait time. So if you've got your board members that are having to wait an hour and a half or 2 hours to actually see somebody, I can assure you probably would hear about that in the next board meeting. Wouldn't you?
Well, you wouldn't hear about it in the next board meeting. I'd get a text message while they were waiting in the waiting room. So, and that's what I like. I've always, and it's kind of a delicate dance that you have in the medical field. You always tell people, I've told our front office staff, I've told our medical staff, the last thing I want to do is spend half my morning in a waiting room, waiting to be seen. I said, that's why we need to minimize that wait time. Now, of course, if somebody's 15 minutes late for an appointment, you may have a little bit longer to wait because that next person got there on time.
But sometimes it's a tough pill to swallow.
And here's, I didn't mean to interrupt. Go ahead.
No, just when you're scheduled for a doctor's appointment at noon, and you learn later that day that a friend of yours had lunch with your doctor at noon when you had a scheduled appointment because you didn't get to see the doctor till like 2 o'clock.
Right,
So
exactly.
Just being able to have that customer service, it sounds like having your patients involved in the board is just that next level up to where we're taking care of the patient.
It is.
So talk to me a little bit about how do we communicate effectively with the community that this is not just a place for Medicaid and Medicare patients, that through our discussions, you stressed over and over, we want the community. And when we say community, we want, no matter your income background, from the people that make the top tier to the people who just don't have anything, we want them to all feel welcome and know they're going to get some of the best quality health care at your new facility.
Well, and I'll tell you a conversation that I have with practically every new employee that we have that comes on staff with the health center. When somebody walks through the front doors of our health center, I want them to feel like they're being welcomed into my living room. I want them to feel like they're coming into my home. I want them to feel valued. I want them to feel like they are worthwhile. I want them to feel like they are seen. And that is why I want to really impress upon the public that we're here for everybody. Because even though we predominantly exist to provide accessible health care to those who may not be able to afford it otherwise, we also want to provide that care in such a manner that it's so good that everybody else is going to want to come too.
Sure.
Because who wouldn't want to go to a place to receive your health care where you can get your labs done, you can get your x-rays done, you can pick up your prescription, you can go to the dentist, you can go for a mental health counseling appointment, all under one roof.
Right.
And that's all in an environment that's aesthetically pleasing, that's comfortable, that's clean, where the people are genuinely glad to see you when you come through the door. Who wouldn't want to come receive their health care in an environment like
completely.
that?
I understand that. When we talk about the health care, I also think that it's important to put a distinction. This isn't an urgent care clinic.
No.
This is for primary care.
Yes.
So I know the urgent cares have their place, and
absolutely.
Lord knows I've had to go to them before. But the model here is for primary care. You're looking to bring that family unit in and be the source for them through geriatrics to when you're a little kid. Right. So pediatrics.
Yeah, and even though we're not an urgent care, one of the things that we are striving to do is set people up with same day appointments. We're not doing walk-in appointments yet, but we are working on building time into the provider schedules each day where we can accommodate those same day appointments. So if you call at 9:30 that day and I think I've got a sinus infection, I've got something going on. Okay, well, we actually have time slots built in
to try to work them in.
Yeah, on each of our 4 provider schedules where we can work those people in that day and get them in.
I think that's important because life happens. We don't get to schedule these colds or these infections that happen. And
the truth of the matter is, in the medical field, anybody that's in the medical field will tell you this, you're always going to have a no-show rate. A no-show rate is something we struggle with. So if we just kind of gauge the patients that are on the schedule that we know may not show that often, we'll double book that slot. And if that person doesn't show, somebody does, and we'll strive to get both of them seen as quickly as possible.
And I also assume that over time you'll start looking at your stats and know where you can squeeze a little more in, or we need to back off a little bit. So let's talk about the mental health side of it. I don't think that's necessarily gets enough coverage in our area. One of the
which is
ladies,
unfortunate because we have such a great need.
Lila
mental
Cork
health.
is the one that recommended me reach out to her, and that's her specialties on the mental health. But to also see you coming alongside with the other providers that are out there, to have a I hate to keep using the one-stop shop, but just an all-inclusive medical environment to where if someone is struggling with some mental health, you have a place that's conveniently located to where they can get that help as well.
Right. I'm glad you brought up Lila Corcoran. She and I have had an opportunity to get to know each other fairly well in the past year, and we're incredibly supportive of each other's missions, and we have referrals going both ways, among our organizations. And she has an excellent model going, and one of the things that we're working on right now, we have one part-time psychologist and a part-time licensed clinical social worker, and we're about to bring on a part-time licensed professional counselor. We have coverage all week, but because of the space limitations we have right now, we just aren't able to accommodate all that space that we need. That's why we're building out enough space in the new facility to have 6 behavioral health offices, which we'll grow into that.
Sure.
But not only just mental health counseling, but we have such a vast need for substance use counseling in this area. And I can't tell you offhand the percentage of patients that we see where if they need mental health counseling, they also need substance use counseling.
Sure.
And, we know, everybody knows what the opioid epidemic has been like. We hear about, you hear something about fentanyl every day, all the other substances that are being used that are having debilitating effects on people. And just like with depression or anxiety or something else, these things become debilitating for them, and to the point where they feel hopeless. Right. And we want to have that place where people can come, whether it be for your depression, for your anxiety, for other behavioral health conditions, or substance use counseling, where we can have those needs met for you there.
Wow. So I think you'd mentioned that the space is large enough to where you envision having like group type meetings that's going to address some of that.
Yeah. I've actually already been approached several months ago asking me if we had any space where an AA group could meet. Right now, in our current facility situation, we're spread across 2 facilities right now. A 6,000 square foot facility where our clinic in behavioral health is housed over on North 7th Street, and then a smaller 1,200 square foot administrative office on Cypress Street. The only conference space we have is one table that can seat 8 people.
Right.
And so we're going to have about a 1,250 square foot community room in our new space where we can offer AA groups, NA groups, other support groups to meet there. We can do patient education events in that room. We'll be able to allow access to that particular area after hours without infringing on the other areas of the
Right.
building, so that we're not having to tie up staff time on having someone there. And we feel like there's such a need for that in the community, to have a community resource. And we want to be able to educate the community in health matters, behavioral health matters, ways to live healthy. Because that's, one of the reasons we came up with the name Pinnacle Healthcare was when we said we want our patients to receive the highest possible level of care. So you're at the peak of the mountain, at the pinnacle of the mountain. And so that's why we want to be able to provide such a broad spectrum of services.
I can also see, and we touched on it a little bit before we started today, that partnerships forming with some of the local hospitals just to take some of the burden off them when you have reoccurring patients coming in for primary type needs, but they enter through the emergency room because that's all they've ever done before,
Right.
and they just really don't know any different. So
Right.
do you see some partnerships maybe forming to kind of relieve some of the burden off some of our hospitals?
I do. We already have an existing relationship with Ochsner. We're working on a relationship with St. Francis. I'm going to be working on a relationship with Glenwood. We already have an agreement in place with the hospital in Winsboro.
Okay.
We're really wanting to expand that reach, because there is, unfortunately, people who are typically unable to afford to go to the doctor. Sometimes things go too far and they wind up in the emergency room. That's why we're trying to educate patients that you have an affordable option here. You can come here and you can receive that care without having to deal with those costly emergency room visits that come. And I believe that's supportive of the hospital systems in itself.
Sure. And I mean, that's not what the hospitals are there for. I mean,
Right.
they're there to treat the things that need to be treated in the hospital. And
Right.
if we can get people to understand that primary care is important,
Right.
Routine visits are important, I think we can improve
Right,
quality
and
of
that
life.
primary care is not an emergency room event.
Sure.
Primary care is an ongoing relationship. that
Well,
you've
Mark,
established.
one of the things that I just kind of keep coming back to is that I want to do my part to make sure the community knows that this is not a place for the least of these. This is a
Right.
place that is going to help all of these
Absolutely.
in our community for quality health care, affordable price, and a person that's running it that's got a passion for people. I can see it in the way you talk, and the talks that we had beforehand. You can see your passion in the healthcare of being able to bring affordable quality care to our community, and I appreciate everything you're doing. I think you mentioned that your heart is pushing hard to get in the new building by January.
I'm hoping January.
Okay. Well, we want to we'll check in with you and let our listeners know kind of as we get a little bit closer. But Mark, I appreciate the effort that you and your team have done to bring quality health care to Northeast Louisiana. And I can't wait to see the grand opening. I want to be there. Hope I get an invite.
Absolutely.
And just see where this thing takes off, because I know that there's many people in our community that has reached out to me to tell me how impactful that you have been in this area, and I can't wait to see where it goes.
Thank you so much, Brian. I appreciate you giving me a forum to talk about something that means so much to me. And I've seen the changes that our health centers made in the last few years, particularly since we got this community health center designation back in 2019, and it just gets me on fire seeing where we're going to be headed in 2024. And I appreciate you giving me the opportunity to share that with the population.
All right. Thank you, Mark.
Thank you.
Welcome to the 318 Experience, the ultimate podcast for discovering the best of what our community has to offer. I'm Brian Bendily, your host and local realtor, with a passion for showcasing the people, attractions, and hidden treasures of Monroe, West Monroe, and beyond.